Okay, so I'm going to talk about the portion that looked at parents and the prevalence of parents who had numbers who had mental illness, but also the associated factors. So our aims were to understand the prevalence rates of parental mental health problems and the associated risk factors. And that is really important to understand that for early intervention and prevention measures and for shaping services for parents and their children. We learned about how Australia progressed their initiatives for family-focused practice, and it was very much underpinned by earlier prevalence studies indicating the magnitude of the problem and then why it needs to be addressed. So we learned from them. So large representative surveys of parental mental health problems and associated risk factors are lacking, and combining the two together is quite novel to look at the prevalence rate, but then also the associated factors of the parental mental health problems. So the aim was then to estimate prevalence rates using a standardised measure of psychiatric morbidity, which is the General Health Questionnaire 12, and to explore the associated risk factors. We had 3 predominant research questions. What are the prevalence rates of self-reported diagnosed mental health problems over the past year and ever? And also, what are the prevalence rates of GHQ-12 assessed current mental health problems? And then how do these two rates compare? So we know that people can have a diagnosed mental illness, but many more people in our population haven't had a diagnosed mental illness and are dealing with that challenge in reality. So we wanted to compare the prevalence rates, of both, really, to have a look at that and make some statements around that. And very much so, we wanted to take it a bit further and look at the associated risk factors then. And then make recommendations that would inform policy, education, research, service development. So the measures that we used were the childhood adversity. That was assessed using the Adverse Childhood Experiences Scale. There's some information about it. I won't really go into much detail, except it was a 10-item self-report questionnaire which measures the occurrence of parental separation, emotional, physical and sexual abuse, physical neglect and household dysfunction. We also used the parents' mental health was assessed using the General Health Questionnaire. As I've said, that's a widely used 12-item self-report measure that has good reliability, validity, and it's used to screen for possible mental health problems within the general population. Then we also asked the parents, did they have a self-reported diagnosed mental illness from a GP or from a psychiatrist. And we looked at family support, the Troubles impact. We asked various demographic questions. So we got a quite comprehensive snapshot of the various factors related to the parent, their environment and their children that might impact their mental health. So our key findings then, the demographic. We had 2,815 parents, and that was a 91.6% response rate. So we got a great sample. The majority were female. The average age was 40. Most parents were married or living as married. That was 71%. More than half had post-16 qualifications, so that's A-level or above. So quite a well-educated population. Over 1/3 were in receipt of welfare benefits. Around 20% were calculated as living in the most deprived areas, quintile, and the majority reported that their children had no special educational needs and that they were in good physical health. With regard to mental health problems, 33% had a past diagnosis of mental health problems and 18% had a current mental health problem diagnosed within the last year. And the most common diagnosis was anxiety, followed by depression. And we had a cut-off score of 4 or more would indicate a potential mental health problem. And then the risk factors then we looked at also, and we found that there were independent demographic, parental and child factors, predictors that increase the risk for the parental mental health problems. So, for example, receipt of benefits, poor family support, history of ACEs, impact from the Troubles, both personally and as a community, Having a child with conduct problems and poor health were all independent risk factors for poor mental health problems. So very much similar to what would have been found in other countries, really. So we'll have a look at the protective factors and get away from all of the negativity. There were good demographic protective factors, so being married or living as married as long as the relationship was good. Better off not being married and being happy than being married and unhappy, so there's a caveat with that. Having own accommodation, home, and not have to worry about increasing rent or losing your home at short notice. Not living in the most deprived quintile, having an income of above 30,000 a year, having qualifications of A-level or above. So they're all protective factors. Parental factors then that would result in mental health problems would be having experienced any ACEs, significantly increased the likelihood of experiencing a mental health problem in the last few weeks. Those who experienced one ACE were almost 2 times more likely to experience a mental health problem, whereas those who experienced 4 or more were 5 times more likely to experience a mental health problem. And then again with the Troubles impact, following on from what Claire had talked about, those who believed that their community was affected by the Troubles by an extreme amount were 4 times more likely to have a mental health problem, and those who believed that the Troubles had an extreme impact on their life directly were almost 7 times more likely to suffer a mental health problem. So you can see, as a mental health professional or any kind of professional in Northern Ireland, you're working with an added complexity then caused by our Troubles here. So child factors that related to parental mental health problems were these. Having a child aged 11 to 19, and many of you that have a child aged 11 to 19 can relate to that as well. I'm sure it challenges your mental health on any given day. So parents with children who scored high on SDQ measures of emotional conduct and peer relationship problems were also twice as likely to suffer a mental health problem. And parents whose children had poor physical health were almost 3 times as likely to have a mental health problem. So you can see a lot of linkage between what Brett, you talked about, the complexity within your own family and the physical and the mental and all intertwined, and what Claire has spoken about, what Kim has talked about. We're all speaking the same thing, really. So conclusions then, what do we draw from this? Well, first, the importance and utility of the findings of this study. Hopefully it will set the context for our future work for many years to come in many directions. It's the first population-based study of the prevalence of parental mental health problems in Northern Ireland. A large representative sample enabled calculation of reliable estimates of the number, age and gender of parents who have had previous or current mental illness, factors associated with it and the types of illness and regional differences. And it flags up so much the need for targeted approaches, that we have a population and a universal-based approach to mental health care, as well as the more targeted approaches that we're all talking about this morning, very much important as well. And it's important to mitigate the risk factors, and that services know that they should shape their services around being trauma-informed, understanding the social determinants of mental health, this holistic response as advocated by the family stress model. And again, Brett talking about, not having a bank account till he was 20. Well, I didn't have a bank account until I was nearly 30, but times have changed, and that is quite, a unique thing now that a child wouldn't be able to have a bank account. So we need to kind of look at the social determinants of mental health issues. So additional support for parents with children who have emotional, relational and conduct disorders. And so I think the overall conclusion of the study was that parents whose children had special educational needs, they were vulnerable, but those who had children who had, for example, children who had ADHD as well as oppositional defiant disorder were much more stressed and in much more need of support. We need to look at physical health and well-being and how that's intertwined with mental health. and all of the time supporting parents and families together at the same time. Okay, so I'll go on to the limitations. Again, resonating with what we spoke about earlier, and a comment from the audience to Kim about the importance of role models being male role models within community groups and the community and voluntary sector, and even within our professions, so that we can better support children, both female and male. Fathers were underrepresented in our sample. Again, there's this underrepresentation. Probably because of the methodology of the study, one parent was selected for each child that was involved, and most often in Northern Ireland, when parents separate, it's the mother that looks after the child. So there was many more mothers in the study than fathers. So future, it would be good to get a more representative sample in that way, in that it could be both parents of a child that was involved in future studies. Data was collected 3 days before lockdown in Northern Ireland, so obviously we didn't pick up on all the stress, additional stress that these parents would be experiencing because of COVID, and that would have been interesting. But again, future research can pick up on that. It was cross-sectional in nature, so it was one point in time, and so we're only able to talk about factors associated with, as opposed to factors that definitely predict mental illness. And so further research then, repeated cross-sectional cohort studies, and more so looking at predictors rather than factors associated. So tailoring our design around that, and obviously having fathers within that research. But we've actually produced one output from this piece of work. Claire has put up 5 or 6 outputs from the other part of the study, so we've one output from this, and it's sitting with the Journal of Child and Family Studies being reviewed currently. So the data from this presentation is hopefully going to be published in a paper there. And so some of this comes from the conclusion of that paper. So basically we're just saying things like it's important to address this area anywhere in the world, and particularly in Northern Ireland, because there are higher rates of undiagnosed mental health problems emerging within our population when compared to current overall diagnostic rates. Therefore, early intervention is all the more important, considering emerging evidence of unmet needs within this subgroup of the general adult population in Northern Ireland, that is parents of children aged 2 to 19. So in summary, a substantial number of parents here experience mental health problems, both diagnosed and undiagnosed, with the estimates of mental illness greater than elsewhere in the UK, and parents in the most deprived areas having higher levels of mental health problems than those in the least deprived areas. Reliable prevalence data on parental mental health and what factors are associated with it is key to help inform education, social services, mental health services, promote early intervention and effective treatment. And the planning and commissioning of health and social care services should always proceed on the basis of the best available evidence, and an accurate assessment of the scale and nature of the mental health problems in the community is key. So that's the key message, really. And thank you for listening.